Well, welcome everyone to our conference tonight. How you doing?
Oh,
Yeah, it's wonderful to meet you all. If you want to come up to the front, we're going to get cozy and let all the empty chairs be in the back. So come on up to the front row, and we'll just be a little more intimate with each other because I just want to make sure I'm projecting and getting everyone's ears in check. So come on up.
yeah, testimonials.
I'm really curious. You guys probably saw this on Eventbrite, or maybe saw an ad, or maybe you just were at the hotel and you saw a sign and you wanted to come in. What is it that you're here for
Okay.
to learn tonight?
Okay.
What is it that you're hoping to learn about, educate yourself on? What are the questions that brought you in the door? Stem cells? It's good. You're in the right place.
Yeah.
Is it specifically where did they come from? Kind of a thing? Or just,
It's pouring away now, and some might come to all different places, but to answer my question,
well, hey, you're good to go then. What else? What else are you curious about? What'd you come?
I'm curious about knowing everything, the weather, how it goes, how you work out, what is it?
Okay, so what are stem cells? Where do they come from? How do they help?
Because this cell that I heard before, don't know that.
Yeah. Yeah. There's a lot of misinformation out there.
Some here you got here we got I said, but I keep hearing it.
Yeah. And it's not very common knowledge, which is why we're here. We're trying to make it more common knowledge and more mainstream. Because here's the big thing. You and I all know that there's medicated healing and then there's regenerative healing, right? I won't say that I have anything against necessarily medicated healing because there are medicines out there that help. However, I will say that there is a lot of money in sick people. There's no money in dead people. There's no money in healthy people, but there's a lot of money in sick people. So big pharma has a big agenda, in my opinion,
Should be.
to make sure that we
Oh,
keep
it's right
giving
here.
them customers. Does that make sense? What we're all about tonight is actual healing. I don't know if I can use that word because the FDA has a lot of stamps that
is
they
this
put
not
on that. But we want to do as much regenerative care as possible and preventative care as possible because by the time you're under the knife in surgery, you're behind the ball. And if that can be prevented, great. That's what we're here to do. So we're here to get a lot of information out about stem cells, a lot to eliminate the misinformation about stem cells. I remember when I first heard about it, I was in high school. And that's 20 years ago now. I just had my 20th high school reunion. Crazy, if you can say that. And I remember seeing the only place to get stem cells was somewhere really scary that I didn't want to look. And I thought, there's no future in this. Turns out there's a future in it. And there's some, dare I say, if I can use the word miracles happening, I will. So that's what we're here tonight. So we have a PA here with us tonight. He's a part owner in the Hawaii Stem Cell Institute. And he's here with
Stem
us.
cells. Yeah.
Yeah, he's all about it. So he's here
Yep.
with us today. He's the expert on this. I'm going to turn the time over to him. So if you would, just put your hands together and help me welcome up Stephen.
Think I'm always never sure where to stand when I do these things. I'm like, should I stand behind the podium? Should I stand in front of the podium? I tend to walk around. So I'll probably just stand here and go like this. I'm just kidding. Welcome. Glad you're all here. You guys probably have some questions about stem cells, what they are, what they do, are they safe? What's going on in the stem cell world. And I've got some answers for you. Not all of them, but some. And the end, what are the regulations with the FDA and stem cells, and how have they changed recently, and that kind of thing. And so we'll talk about that a little bit too. We'll probably do a question and answer at the end. So if you have questions, just hold on to them, and we'll get to them.
Worry.
All right. I left this title. This was a title I used to have on this presentation, which I made about a year ago or so, and I've updated it as I go. But because this was the verbiage that we used to have to use with the FDA, was regenerative therapy with umbilical cord tissue support matrix, and we couldn't say stem cells. That was a buzzword, a bad word. Now we can, and it's not such a taboo anymore. The FDA actually passed a regulation, a law that was passed that said, these things are real, They actually do help. We can start talking about them a little bit more now. And that happened just in May, I think. So May of this year. So really I would have changed this to probably regenerative therapy with mesenchymal stem cells kind of thing. A little bit, is my intro hidden? Let me see. I think it is. So let's unhide that because you guys should probably know who I am and why I'm qualified to talk about this stuff. Okay. Sorry, there's always technical glitches. We'll go back a little bit. You guys don't, that's a scary place. All right, so a little bit about me. I'm an independent physician assistant. I'm actually the first independent physician assistant here in Utah. And that was, that happened back in 2022. As a result of COVID, we needed more independent practitioners, providers, just across the state. So Governor Cox passed a law that went through the legislature that said PAs can now practice like nurse practitioners here in Utah and can be, as long as they have enough experience, they can be independent. So they don't need supervision anymore. And so I've been practicing total for about 15 years. The majority of that was in orthopedic surgery. So I did orthopedic surgery for almost 10 years in Washington State, Tacoma area, and then about another 3.5 years here in Salt Lake City area. That's where I started with stem cells, actually. The surgeon that I was working with, we kind of started doing stem cells in a lot of our pro athletes that we were doing surgery on, our D1 athletes and our pro athletes, because we need to get them back to playing, right? And if you do an ACL reconstruction, the typical recovery time is about 6 to 8 months. And that's a long time to be out, especially for our pros and our D1s. So we would put stem cells in their knee afterwards, or in their hip, or in their ankle, or wherever. And it literally halved the recovery time so we can get them back quicker. So then we started saying, well, we have patients that need surgery but can't have surgery for some reason or other. Let's give them stem cells and see how they do. And they did great, of course. And they didn't need surgery. Not so good for a surgeon, right? If you're a surgeon, you got to do surgery to make money. And so if you're making people better and not doing surgery, it doesn't quite make sense. So I ended up getting out of orthopedic surgery back in 2018 and started doing this kind of full time. And that was around the same time that I partnered up with my business partner in Hawaii, and we opened up the Stem Cell Institute of Hawaii. So I go out there every so often and treat a bunch of patients. I was actually out there this last weekend. It was beautiful. But it's a whirlwind because I end up treating like 30, 40 something patients in a couple days. And everybody's doing great. So really good. I did my undergrad, BYU, medical training at Eastern Virginia Medical School. That actually is wrong. That should be 9 years. I have done trainings all over the country. And so I've done seminars and trainings all over the country on stem cell regeneration, alternative medicine, functional medicine, and ultrasound-guided injections. I'm also an expert at ultrasound-guided injections, which I think is great. It's always good to use the ultrasound, especially when we're going at places that are hard to reach, like low back, hips, things like that. Specialize in non-surgical orthopedics, married, 4 kids. That's one of my favorite beaches on the Big Island there. Just a little fun. So again, I mentioned the scary place. I spent more years in that room than I really wanted to. Surgery was great. I enjoyed doing surgery. I'm very hands-on. I enjoyed suturing wounds and things like that. It got to me when surgeons are pushing so much for surgery without even considering other options. It's like, oh, you have a bad knee? All right, let's put a steroid injection in. Oh, that didn't work? All right, knee replacement. And it's like, whoa, you just skipped like 10 steps there. But that's what the surgeons do. And I didn't really agree with that. And so I started butting heads with surgeons because I was like, well, what if we try this? What if we try this? No. We got to do surgery. Okay. I don't think so. So anyway, we try to keep you out of there if we can. Sometimes, most of the time we can. I'd say probably about 80-90% of the time we can keep you out of the surgical suite. But sometimes it's inevitable. These are some things. They're supposed to be one of a knee there, but it kind of disappeared, it looks like. But that's a hip, bone on bone, right up there. That's a shoulder. That's a really bad shoulder. Big bone spur here, bone on bone there. I had a knee right here that showed bone on bone as well. Any of you guys have bad arthritis? Yeah. It happens as we get older. If you were an athlete, it happens sooner as we get older. If you had any kind of procedure done on your knees or your hips or your back, the arthritis is just, it's like 100 times worse because surgery makes things worse in a way. And I'm not trying to badmouth the surgeons or surgery. I think there's a place for it. I think it does great things, and it's definitely needed in certain circumstances. But I think for elective procedures, when there's other options available, maybe not the best option all the time, kind of thing. Let's see. Are we moving? What are we moving here? What is going on? Try this again. It's not moving through the slides for some reason. IT. It's not even going. It just starts from the beginning. Lovely. Okay, well, maybe we can go through it here with just kind of the things on the side. That might work. Oh, yeah, there you can see the knee. So that's bone on bone. Neck, low back. This neck is not normal. You can probably see that. It's way too straight. It actually has some kyphosis, which is not supposed to have. It's supposed to be a C shape. That's not normal. This is not normal. You can see that vertebral body there is slipped forward on this one. So that's called spondylolisthesis. And that's disc damage there. This is an ankle. You can't see it real well because it's whited out, but that's pretty bad ankle osteoarthritis. So these are things that are commonly hard to treat. You know, everybody has them. They're very, very prevalent. Everybody has them, but they're hard to treat. And so we do the best we can in medicine, but I think we can do better than just pushing people into surgery all the time. I mean, autoimmune diseases, you can't even do surgery on a lot of this stuff. You got rheumatoid arthritis here, lupus, thyroid disease like Graves, Hashimoto's, multiple sclerosis, Crohn's disease, diabetes. Diabetes is everywhere, right? Diabetes is an autoimmune disease. Your body doesn't use insulin as well as it used to with type 2 diabetes. Type 1 is genetic. You just kind of got the craps there, but type 2 is autoimmune. So how do you treat autoimmune? You know, that's a tough one. You ask an orthopedic surgeon, they'll be like, I don't know. Surgery? Probably not. Stem cells actually work very well for autoimmune disease. This is where functional medicine, alternative medicine, stem cells shine with autoimmune diseases. Also with osteoarthritis, but autoimmune diseases for sure. Neuropathy. Anybody have neuropathy? Neuropathy is awful. The most common cause of neuropathy is type 2 diabetes. And that's because diabetes is a vascular disease, right? You got too much sugar in the blood, and the sugar acts like little shards of glass as it goes through the blood. There's too much of it. And so it goes through and starts damaging all of the vasculature around the area. And then you get less blood supply, less oxygen, and all of a sudden the nerves start dying in the feet. And they can't feel anything, okay? Now that can be very, very bad because if you get a cut or if you get some kind of wound on the foot, you don't know it's there, all of a sudden it gets infected, it gets gangrene, and then you lose your toes, you lose your feet, you lose your leg, okay? I've done those surgeries. They're awful. You ask a lot of docs, how do we treat neuropathy? Most of them will say, not much to do, really. Typically, you'll get a prescription for Lyrica or gabapentin, maybe pramipexole, trazodone, pain pills. These are not great options. A lot of these medications have side effects. And again, you're just kind of furthering the big pharma, let's keep people sick, kind of thing. Stem cells have been shown in studies, even recently, to be very, very effective for neuropathy. Of course, there's always an underlying condition, usually for neuropathy, that you have to also address. So if the underlying condition is diabetes, then if you treat with stem cells, but their A1C is at 10, it's not going to really help very much. So we got to get the A1C down. We got to eat better. We got to lose weight, right? And just doing that will make this stuff better. But nerves don't do anything quick except get damaged. They get injured real quick. but they don't heal very quick. They heal very, very slowly. And so what we found with the stem cells is that we can actually increase the rate of recovery and healing of the nerves. So they actually get better over time. And then if the diabetes is better too, we can keep the nerves healthy. So I'll talk to you a little bit more about that. These are very common. Rotator cuff tears, meniscus tears, ACL tears, very, very common. I'm sure some of you in here have probably had some of these. Typically, if it's a small tear, a lot of times the doc will say, yeah, it'll heal on its own. It just takes, a couple months. No worries. You got a partial rotator cuff tear. Yeah, it's sore. Work on some strengthening exercises, work on some stretching, try not to overuse it. But if you get a big complete tear like this guy here, a lot of times nothing's really going to help that except for surgery. Unless you do stem cells. Huge tears, you're probably not going to get a huge retracted rotator cuff tear to heal with stem cells. Most likely not. I mean, you're talking about taking a cup of water and pouring it in a desert, right? Nothing's really going to grow there. But for partial tears or small full thickness tears, stem cells are amazing for ligament and soft tissue injuries. Achilles tendon tears, there's a lot of data right now that says most of the time you don't even need to do surgery on Achilles tendon tears. Even completely torn tendons, you can cast them or boot them for months and they'll heal. They'll heal on their own. Imagine if you put stem cells in there, they heal even faster. Tennis elbow. Anybody ever had tennis elbow? It's not fun. They call it tennis elbow because it usually is from a sloppy backhand. Usually from a sloppy backhand. But it's just ongoing tearing of this common extensor tendon right here, and you get pain right there. And it never seems to go away. And it'll either last a year and then you just kind of get used to it, or you can put a bunch of injections in there with like PRP or stem cells, or you can even put some steroid in there and it goes away and you just try not to overuse it, or you do a surgery on it where you actually just cut that tendon a little bit and so that it doesn't just keep doing this. It actually separates and then you get scar tissue forming. But stem cells, very, very good for soft tissue injuries and ACL tears and things like that. Memory issues, brain fog, Alzheimer's, headaches. Anybody forgot why they're here? You laugh at that, but I actually had one guy one time, he said that. He's like, not you, maybe it was you, who's like, I don't know why I'm here. I thought there was food, or something like that. But Alzheimer's is a big problem. And again, another one that there's no cure for. Difficult to treat. There's medications like Aricept and memantine, and you can use supplements like lion's mane's mushrooms, and you can use NAD and things like that to try to increase oxygen to the brain. But what it comes down to is the degeneration of the brain. There's just no real way to stop it or reverse it permanently anyway, or to cure it. What we found is that you can slow it down. And if you have a family history of Alzheimer's, you could actually do a little bit of preventative medicine with stem cells and supplements and things like that. I've actually treated a lot of people intranasally with stem cells, which is using like a catheter, a spheno catheter, where you put the stem cells way in the back of the sinus there and just allow them to absorb up through the cribriform plate and the soft tissue into the brain, which will bypass the blood-brain barrier, which is nice. And that's shown some pretty good results. And there's, all of the main learning and research schools are using stem cells to try to figure a lot of this stuff out, okay? And so none of it is like precisely documented, like we found the cure, kind of thing. And that's why FDA hasn't approved stem cells to be used for any specific treatment or cure for a disease like a drug, right? They bring a drug out and they say, okay, this drug is FDA approved to treat this, right? We can't do that with stem cells, at least not yet. But what I usually tell people is stem cells are, I don't want to say panacea, but they pretty much repair and regenerate and heal. So where you put them, they're going to do that. So if you put them in the brain, they're going to do that, but people frown if you start injecting into the brain. So we do it intranasal. I just kidding. So why do these things happen? Why do we get autoimmunities? Why do things break down? Why can't we do things like we used to do? Why is it that, well, my kids are older now, but I remember one of my third kid, when he was 3, just tumbled down the stairs. And I just watched him. I was at the top and he went, and he just bounced all the way down. And he got up at the bottom of his life. That was okay. And he ran off and played. I was like, man, if we do that now, we don't get up and go off and do something else. It's like, call the ambulance. It's break, dislocation, you know. Why does that happen? The short answer is our cells continue to die off as we get older. And we have less stem cells, we make less stem cells, and our stem cells turn over a lot slower than they used to when we were young. This is why babies grow so much, because they have just millions and billions of stem cells, right? And those stem cells are just going on overtime, and they're going to help the baby grow. As we get older, we don't make stem cells like they do, and we make less, and they're not very potent. And so when we get a scratch or a cut or a break, it takes forever for it to heal as we get older and older, especially if we have comorbidities like diabetes, you know, and things like that. This is kind of an interesting slide. A newborn stem cell doubles every 24 hours, right? Just they're on overtime, going, go. After 30 days, about 1 billion cells. One stem cell from a 35-year-old doubles about every 48 hours. After 30 days, 32,000 cells. Look at the difference between 1 billion cells and 32,000. Would you rather have $1 billion or $32,000? $32,000, you could probably buy yourself a nice car. Right? Careful. And then 65-year-olds, every 60 hours, after 30 days, 200 cells, a measly 200 cells. This is the number one reason why I tell people when they ask me, should I get stem cells taken from my own bone to put in myself? And I say, no, because of this reason right here. Your stem cells are not healthy. They're not good, and you don't have very many. And so a lot of docs will say, oh yeah, I can do a procedure on you, and we'll make a little cut here, and we'll drill into your bone, which hurts like heck. I'll tell you that right now. Because I had people come in who had that procedure, and they're like, the procedure hurt more than anything else. And it's like, well, why are we doing this then? So they take the bone marrow out there, and the bone marrow does have stem cells in it, right? Spin it down, they take the fluid, and you're like, okay, I got this fluid now. How many stem cells are in it? Don't know. How good is the stem cells? Don't know. Is there any stem cells in it? Don't know. But we're going to put it in there and see what happens, you know? And so that's why I think using the stem cells, the allograft stem cells from the umbilical cord, placenta tissue are much, much better option if we're looking at doing stem cell therapy because of this reason right here. And because they're fresh, they're brand new, they multiply like crazy, and there's a ton of them, right? So there are these things called stem cells. Shh, FDA's around, right? No, I'm just kidding. We can talk about them now. There are these things called stem cells. We make them in our body. That's how we regenerate. You know, when we get hurt, that's how we grow when we're kids. There's different types of stem cells. So these embryonic stem cells, these are the ones that we're not allowed to use, and for good reason. These are the ones where they took and tried to clone cows and stuff like that and didn't quite work out too well. And they decided these are too dangerous because they're so aggressive and they're meant to form something, right? Like a baby or an organ or something. And so we saw that when these were used to try to heal damaged stuff, all it did was kind of go out of control and create tumors and teratomas. And what happens when cells go out of control? What do we call that? Cancer, right? So that can actually cause cancer, those kind of things. So they're not allowed to be used except in research in the States here. We have adult or somatic stem cells. These are the undifferentiated cells found within all of us in different places that are not as aggressive as the embryonic because they're not meant really to form an organ or a baby. They're actually just meant to replenish and regenerate tissue, right? And what tissue they regenerate is determined by where they're at and kind of pre-programmed into them. And so they're found in many places in the body. Actually, there was a recent study that showed that mesenchymal stem cells or adult stem cells actually can be found also in menses, blood menses. And there was another one. Well, we know adipose tissue, bone marrow. There was one that I thought was really cool. Well, when we know umbilical cord and placenta, I'll think of it in a minute. But found all over the place. Again, but less and less in adults as we get older and older because we don't heal like we used to. We don't create cells like we used to. And so again, these are within that adult stem cells or mesenchymal stem cells, we actually have different subtypes of stem cells. So there's these hematopoietic stem cells, which are stem cells usually from the bone marrow that are just kind of pushed into the lineage of blood cells, like red blood cells, white blood cells, leukocytes, things like that. Then we have mesenchymal stem cells, which are your pretty generic tissue-related stem cells. We have neural stem cells for the brain, epithelial stem cells for the organ lining, and skin stem cells, because we slough off our skin all the time. And if we did that and things weren't regenerating, we'd have no skin, right? That wouldn't be good. Vital functions. It's actually 5. I changed this slide, but this is an old one. So we know what stem cells do, and there's been lots and lots of study. And if you look at the studies now from NIH, National Institute of Health, this is pretty much common knowledge that this is what stem cells do, right? They differentiate and specialize. We know stem cells can turn into different kinds of specialty cells, right? They replicate. We know that 1 becomes 2, and 2 becomes 4, and 4 becomes 8, and so on and so forth. This is kind of cool. There was a lot of studies showing that stem cells have a homing mechanism in there, pre-programmed into them, so that when they're put into the body or within your own body, there are signaling cells called chemokines that tell the stem cells, hey, this area is damaged over here. Go that way and congregate over there and fix that. And so that's what they do. They actually home to areas of the body that are inflamed and damaged, which is amazing, because you could put stem cells IV in the body and they're going to go where they need to go, right? And sometimes we don't see exactly where they're going, but we know they're going somewhere, and they're going to help. They repair and regenerate tissue. And then the 5th one was signaling. Probably the most important aspect of the stem cells is the signaling aspect, because they signal not only to other cells once they replicate, but they signal to your own stem cells in your body to incorporate them as well to heal the area, heal the damaged area. And this cascade of signaling goes on and on and on. Even after the original stem cells that we put in are gone, this signaling is still happening. And so these stem cells are still proliferating through this signaling process. The guy who coined the term mesenchymal stem cells actually also said a better apt name would be medicinal signaling cells as well. So that was kind of cool. Adult stem cells. This is from the International Society of Stem Cell Research, right? Mesenchymal stem cells originally discovered in the bone marrow. We knew that, but have since been found throughout the body and can give rise to a large number of connective tissue types, such as bone, cartilage, and fat, right? We don't necessarily want that 3rd one, but bone and cartilage would be great. Mesenchymal stem cells found throughout the body, including the bone marrow, can be directed to become bone, cartilage, fat, and possibly even muscle. So again, like I said, they're tissue-oriented. And so then the question is, well, how come they're not as aggressive as the embryonic? Like, what's going to stop them from just going and going and going and creating bad tissue? The cool thing is that they're pre-programmed and self-limiting. And so they fix what they're supposed to fix, and then they kind of move on. And that's it. And that's the magic of mesenchymal stem cells. This is from a study back in 2006, 2013. There's studies even from last year and this year on stem cells, but found low density in the blood. So you can find them in the blood. Very, very low density in the blood, though. Blood is usually better for platelet-rich plasma and proteins and healing and growth factors and platelets, not for stem cells. So if you're just taking whole blood hoping to get a bunch of stem cells, that's not the place to get them. And so these MSC-like cells can be isolated from umbilical cord blood, placenta, perivascular areas, amniotic fluid, tissue surrounding the umbilical cord, Wharton's jelly. Everybody heard of Wharton's jelly? It's not something you put on toast. Wharton's jelly is the jelly-like substance around the vasculature in the umbilical cord. And it is chock full of these mesenchymal stem cells, because that's what feeds the baby, right? Because when a woman gets pregnant, she has to make a few things. A few things have to get made first, right? The baby starts growing, but there's got to be an umbilical cord, there's got to be a placenta. What makes those? These stem cells. And they're chock full of them in that Wharton's jelly. That's why the Wharton's jelly and the from the umbilical cord and placenta tissue are the best place to get the mesenchymal stem cells, because there's a ton of them and they're brand new. Yep, we talked about that. There's not compelling evidence that MSC is guided by chemokines. I talked about those already, and other cells cues to areas of pathology and home specifically to those areas. Again, and these are from studies. So this is not just some website saying, hey, this is what it is. No, these are actual studies. These are people who have done studies. So we got kind of the baby and the umbilical cord, and we have these, we can isolate the mesenchymal stem cells from there, and they turn into hematopoietic stem cells and mesenchymal stem cells and chondrocytes and osteoblasts and epithelial cells and muscle cells and all kinds of stuff. these actually didn't get hid, but that's okay. So that was just a slide showing there's a lot of companies out there that will provide a stem cell product. I don't know where it is. Yeah, it is supposed to be hidden, but oh well. This is just one of those. All three of the clinics that we're talking about today, the Pure Life clinics and the Cure, use RRG, which is Regenerative Research Group. And they have been around for a long time. They're based here in Utah, and they have a huge stock they kind of went crazy before COVID and had a bunch of donors, placenta and umbilical cord donors. I mean, we're in Utah, right? And so they have a huge stock of pre-COVID umbilical cord and placenta tissue that they've harvested the stem cells from, which is nice because nobody likes COVID. And for good reason. But yeah, I mean, usually it's cryo-frozen to preserve it, and then shipped overnight, usually and kept in a cryo freezer and that kind of thing. Let's see. Okay, methods of administration. So typically, it's injection. And my thought process on this, after doing stem cells for years and years and years, was yes, you could pay $20,000, go down to Panama to the guy down there, and he'll put 300 billion stem cells in your IV, and that could probably be okay. But they're expanding them, which is something we're not allowed to do here in the States. We don't mess with the stem cells, because when you start messing with stem cells, you get problems. And there's been clinics that have done that, labs that have done that, and it's turned out really bad. There was a lab in Florida actually that did that. A few people died because they were expanding the cells and putting them where they shouldn't be putting them. So minimally manipulated cells is what the FDA has regulated. Okay, so that's what we do here. But I tend to think that if the knee's a problem, I should put the stem cells in the knee. I don't want to put them IV. They're going to go other places because nobody has a perfect body and everybody has some kind of kidney disease and heart disease and liver disease and who knows what, But if I put the stem cells in the knee, most of them are just going to stay right there in the knee. We might get a little bit of migration, but they're going to stay in the knee. I want to put them in the back. I want to put them where the problem is. And so I do local, I prefer local injection if I can do it. So if somebody comes in and says, yeah, I got a shoulder problem, rotator cuff tear, I'm not going to put it IV. I'm not going to put it anywhere else. I'm going to put it right at the tear because that's where it should go. So local injection for autoimmune diseases, a little bit more difficult. When somebody comes in and says, I got type 2 diabetes, I have rheumatoid arthritis, I have multiple sclerosis, I have Alzheimer's, things like that. What are we going to do? Because you can't really inject a specific area for those, right? They're autoimmune disease. So for that, I think IV is optimal. Put them IV, let them go in the body. They're going to seek out areas of inflammation and damage. They're going to home to those areas, regenerate, duplicate, and heal, right? So and then intranasal was the other one I talked about a little bit for the brain. That's a little bit more of a specialized procedure, but very, very well. It's kind of like remember ever get to get the COVID test and they shove it way up there and it doesn't feel so good? That's kind of what it feels like. But very, very good. And I've seen some really, really good things with it as far as like macular degeneration, Alzheimer's, brain fog, MS. Some really weird stuff too. I had this one kid in Hawaii who had cyclical vomiting. He just could not, he would vomit like 3, 4, 5 times a day, every day, and just wouldn't stop. And so I thought, that's a weird one, that's gotta be something up in here. So I treated him intranasal. He went from like multiple times a day to maybe like a couple times a month. Cyclical vomiting. Vomiting is not fun. That's really affects your life. So, and he was a young kid too. So I was like, yeah, we got to get this taken care of. So he did really well. But I haven't seen that a whole lot. Intranasal for the brain. Yep. I don't know if we did an IV. We might have done some blood ozone as well, but the stem cells were intranasal for the brain. This is not an all-exhaustive list, but these are some of the things that I've helped over the years, and things that have really responded very well. The number one thing I treat is knees. Knees, if it's an osteoarthritic knee and the surgeon's saying you got to have a knee replacement, most of the time with about a 90% success rate, I can keep you out of surgery and make that knee feel better with the stem cells. And that's more motion, less pain, more function, and we don't need surgery. That's my success kind of, not guarantee, but that's what I judge it on. But a lot of things here, though. These are some big ones: neuropathy, diabetes, MS, anti-aging, wrinkles. I've done a lot of aesthetic stuff with stem cells. Injections in the face, injections in the scalp. It works very well for hair loss. And that's been very well documented and studied. PRP has been used for hair loss and facial, like vampire facials, for decades. Works very, very well. Now, if you add the stem cells, which have the actual duplication regeneration aspect, it works even better. And so you can do injections of stem cells in the face, the scalp. It helps with hair loss. It works very, very well. So we're kind of winding down here again. I always stress to people, this is not a treatment or a cure for any specific disease. And that's kind of what the FDA wants to make sure that we're saying, is that I'm not saying this is going to heal your diabetes or cure your Alzheimer's, but it's going to help. It's going to help. And it's a nice, holistic, safe approach to it. FDA allowed, but not FDA approved. We talked about that already. No guarantees. That's the one thing. People always want a 100% guarantee, and I'm like, there's not a 100% guarantee in anything. I mean, you could take the easiest little carpal tunnel surgery, and you could still have complications with that, with anesthesia and wound and infection. I mean, it's nuts. But like my mom is willing to go get a hip replacement when I told her, let's put some stem cells in your hip. No, the doctor said I have to have a hip replacement. Okay. Whatever you say. So we strive to keep people off medications, out of surgery, while improving function and decreasing pain. It's usually a team approach with multimodalities, right? Because what we've seen is that there used to be clinics, and there maybe still are some clinics that will put stem cells in you and then just send you out the door. See you later. Hope you live a good life. And what we found with that, the study showed that they got about 50% results, good results, about 50%, 50-50. When you add in other modalities like these things down here and support the stem cells with PRP and ozone therapy and red light and acupuncture and e-stim and, vibration, you get probably like 80 to 90% success rate on these. And so that's usually the protocol of the program that I tend to endorse. And that's what I do in my clinics as well. So some frequently asked questions. Again, try to start thinking away from the pills. Pills don't really help. We know Big Pharma doesn't want people to get better. They want people to stay the same. So you keep buying their pills, right? Surgery is good, but not always. So maybe think about that. Is this insurance covered by insurance? What do you guys think? Absolutely not. Maybe someday, but not right now. Again, because it's not FDA approved like a drug, and insurances like to see that FDA approved to cure this. And so it's not covered by insurance. There's a couple insurances that I've seen cover it. One was the VA. The VA will actually cover stem cells if you have a provider that says this patient has done everything that we could think of under the sun. They don't qualify for surgery, so we're going to try stem cells. And I've seen the VA pay for that. Another one was kind of a mutual insurance that was more kind of everybody pays in and they pay out certain amounts. And so it wasn't like the mainstream insurance companies like United and Select Health. They won't cover it. How much does it cost? It depends. It really does depend on how bad the problems are. If it's just a single knee arthritis and you're like, I don't want to have total knee replacement and I want to put stem cells in, it could be relatively inexpensive. It's pretty affordable. Usually under $5,000, which is nuts because 10 years ago, well, even 5 years ago, clinics were charging $15,000, $20,000 for the same procedure in the knee. And people were paying it. It's just crazy to me. Is there any chance of reaction or tumors? Nope, not with these types of cells, because we're not using those highly aggressive embryonic stem cells. We're using the mesenchymal stem cells that are tissue-oriented and they're self-limiting. So there's no chance of reaction or tumors. Reaction, I mean, you worry about this because it's like blood, right? You go to donate blood or receive blood, you got to have matching, right? Unless you're O negative. O negative is a universal donor, you give to anybody. That's what these cells are like. These cells are privileged, pluripotent tissue that have no surface antigens and they haven't taken on a specific lineage yet. So really, they don't have any specific DNA markers that say this has to match with this. They're more like O negative blood. They can be given to anybody, and then they will become your cells. How long does it last? This one is variable, but on average, I would say it's a couple years at least, but usually more. An example of this, I put stem cells in my own right knee back in 2018, about 6 years ago, and because I had a meniscus tear. Back in my BYU days, I had a really bad meniscus tear, lateral meniscus over here. Couldn't run, couldn't walk, couldn't do anything really. So I had surgery, arthroscopy with Dr. Kimball. I don't know if anybody remembers Dr. Kimball. He did my scope, and he took out a large chunk of my lateral meniscus, like a pretty big chunk of it. It was split pretty bad. And usually when that happens, typically the knee is really set up now to have early osteoarthritis and problems because the meniscus are the cushioners, right, in the knee. And if you don't have those cushioners, you start to grind cartilage, and it can be very painful. And so after he did the surgery, it was better, but it wasn't awesome. It was like, I can kind of play some sports. I can't really run very hard. Hiking was no way still. So I put stem cells in 2018. Over the next year, I kind of supported it with some PRP and some ozone injections. I inject myself, by the way. No problem. Don't slip. It's done great, like amazing. I've been able to get back to running, sports, hiking. The only time it really bothers me is if I'm going directly downhill, like straight downhill, and then it starts to hurt a little bit. But I could hike again. And I'll show you guys a picture that me and my son hiked Kings Peak a few years back. And that was fun. But it lasts quite a while. I'm still going good. And you know what's cool is that I actually took x-rays throughout the last years to see, okay, how much am I decreasing? Because I had surgery, and I know that if you have surgery, you have usually a higher chance of osteoarthritis early. I haven't really shrunk hardly at all on that side, on that lateral side, which is awesome. I'm like, great, my knee's gonna last longer. And I don't need any more surgery. I wouldn't want it anyway, unless it's absolutely necessary. Is it effective? Absolutely. Is it safe? Absolutely. The biggest question, and I tell people this is probably the biggest question, will it help me? Will it help me in my situation? And I'll give you one example of this. I had a guy come in, 2 examples actually. One is why you shouldn't do surgery based on just looking. I had a guy, my first couple years of orthopedic surgery, I had a guy come in walking like this. He came in, he's walking like this. And I was, oh, hey, how you going? You're here for your knees? And he goes, no, I'm here for my shoulder. Like, well, what's wrong with your knees? Oh, my knees are fine. They've been like this for years. They don't bother me at all. And so I was like, well, okay, that kind of, just a little change of paradigm there. Like, okay, well, they don't bother him. So that's a knee you should not operate on, right? The second one is I had a guy come in, this was probably a couple years ago. He comes in and one leg is straight, the other leg is bent like this. Okay, so he's got a cane and he's coming in like this. And he did a consult with me and I said, okay, what's your goal with this? Like, are we looking for pain relief? Are we looking for improved function, better strength, walking better? And he says, no, I want my leg to be straight. And I said, this is not the place for you. The stem cells do not have the power to take a knee bent like this and go and put it straight again. I was like, if that's your only goal, you want your knee to be straight, surgery is probably your path. So stem cells won't work for you there. So again, will it help me in my situation? I've got to use a little bit of common sense and what can we expect these stem cells to do kind of thing. But if you don't know, then that's why it's good to get a consult with me because I'll tell you. And just like I told that guy, I was like, I don't think this is the place for you, man. Anyway, the picture you got on there. My picture. I had a picture of me and my son on the top of Kings Peak that we did just a couple of years back. Hiked all the way to the top. It's the tallest peak in Utah. And no problem going up. Little bit of pain coming down, but not too bad. But I was able to do it, Pretty cool. I love waterfalls, by the way. This is a waterfall on Kauai, Wailua Falls. And this is a waterfall, pretty tough hike in Yellowstone National Park. Again, love hiking. So anyway, thanks for coming. The website's not showing up, but again, we have clinics that we have, Pure Life in Orem, Pure Life in Cottonwood Heights, which I'm the medical director of in Cottonwood Heights, and then the Cure in Pleasant Grove. as well. And so, and we all use the same product from RRG, which is a great product, by the way. I've been using it for years and you've seen great results with it. So I'll end there and we'll take questions in a little bit.
All right, friends, put your hands together for Steven. Thank you so much.
Thank you.
All right, we have these cards, so take a moment right now, and if you have questions, go ahead and write them down. I'll collect them, and we'll kind of do an open forum Q&A as well. While we're getting those put together, we have a couple of our clients, patients, that said that they would be willing to share their experience with us. So we're going to share with you some testimonials. Would you guys be interested in hearing what they had to say? Yeah? One of them is
Sure.
Ryan Bishop right here, a good friend of ours. It's his dad that came into our clinic. Both his dad and his mom came into the clinic, and his dad recorded a really cool video for us. We'll show it to you right here if we can get that sound working okay. How's that looking, babe? He recorded this just today. Our daughters are actually on their senior trip out at their house right now. And Scott is down in Hawaii. He does art restoration. So he's working on taking a fresco off a wall right now. And how old is Scott? He's 70 years old, still climbing ladders, up on scaffolding, doing all this. And
Cool. Intellect, muscle, fast, core, this. Assert for really on the help for us. Why? Cool. For buffers in more than
awesome. Cool. Thank you, Scott. I always like giving a round of applause for people that aren't here because it really, I believe that it gets to them. I bet somewhere in Hawaii he's like, oh, thanks. Was there another video that we had to share? Does anyone have any questions that they've written down that I can have you pass toward the middle and I can collect those for you? I'm not going to answer them because I am not the expert, but I am going to bring the experts back up who can answer them. Are there any others that we have written down? Okay, beautiful. Yes, it's Jordan, right? Yes, perfect. And Steven, we're going to have you come back up, yes, to help answer questions. I am terribly disqualified to answer any of these, so I would love to have them come up. Can you please give Jordan and Steven a huge round of applause one more time?
I have to put my microphone back on.
So we have one question that's come in. If you have more, feel free to raise your hand as they come up, as they come to you. But this one, first question, I'd love for you both to answer it if you can. The results with CMT and nerve regeneration or restoring, what was the atrophies or dead muscle? Is that a possibility that ever been done?
I think it's definitely a possibility. It's difficult because dead tissue doesn't like to respond really to anything. Once tissue is atrophied enough to the point where it's not really having any more blood supply, and it's just kind of there and scarred down, it doesn't like to respond. Now, we can still try to put stem cells in it, and I think it will get somewhat better. It just won't get back. It's not predictably going to get back to normal, if that makes sense. But nerve regeneration, it works wonders for nerve regeneration. I mean, I've taken people that have type 2 diabetes, neuropathy all the way up to the knee, can't feel anything below, and usually after 3 months, I can get it to where they're feeling everything except for their toes.
Wow.
And so the stem cells really work on regenerating the nerves. And then if you support it with a program where you give the nerves sustenance and healing, like with PRP, healing and growth factors, proteins, platelets, and then oxygenate it. The body loves oxygen, right? That's why hyperbaric chambers work really well. And so in the form of ozone, I usually inject ozone at the nerves on a weekly basis for months,
Wow.
just trying to stimulate those nerves and oxygenate them. It works
Sounds like you get to have a trip to Hawaii.
it works really well.
Better oxygen there, right?
You can come to Hawaii if you like. I can also do it for you in Cottonwood Heights.
All about oxygen. I'm like, my doctor said I have to go to the beach, so I'm good with that. Awesome. George,
Did that
do you-
answer your question?
Yeah.
Just to add to that, we actually have a patient of ours up at Cottonwood Heights that is experiencing neuropathy pain, right? Similar to the question that you're at. Yeah, he's getting fantastic results just 2 weeks in. So, I mean, that's the other is done.
Right.
It's more
Just numbness, right? Yeah, and that's pretty typical because most of the neuropathy is numbness because there are different types of neuropathy. There's the type of neuropathy that causes like burning pain, like needles like we saw in there. And then there's the type of neuropathy that's just dead. You don't feel anything. You know, you could drop a bowling ball on it and you're like, I don't feel it, you know. And I've treated those people and they get better with the program. So it works really well.
Awesome. Thank you. Other questions, just by raise of hand. Oh, yeah. No, I can read it for you if you like. Oh, it's beautiful. How often do you need injections?
So it depends on what's going on and what the program is. My typical protocol is to hit it with stem cells and you hit it with the correct amount of stem cells. And I say correct amount because it varies based on what I'm trying to treat. So like I had a younger girl come in with, she had previously had an ACL reconstruction and an MCL reconstruction and meniscus reconstruction. She's still pretty young. And so now she's set up to have really bad arthritis in that knee, plus she has a ton of scar tissue. And so typically I would put about 1 unit or 1 cc of stem cells in a knee. That's usually fine. For her, I'm going to recommend 2 units because I want to blanket the knee, but I also want to target the specific areas inside the knee that I'll use my ultrasound for. And so that's 2 injections. And then I usually treat on a weekly basis for the next 3 or 4 weeks, supporting it with PRP and ozone therapy, and then see them back in a month, do some more injections, see them back in a month, do some more injections. So it's quite an involved process and it's quite a few injections. But I think that's the best method.
Oh, go ahead.
I have a
Mm-hmm.
so
Mm-hmm. Yeah. It might be a secondary cause based on how you're walking because of the meniscus tear. Mm-hmm. Inevitable. We all do. Yeah.
Oh.
So, yeah, if we were trying to target the meniscus and the arthritis in the knee, it would be an injection at the meniscus on the side of the knee, and then some there, and then the rest into the joint. And then I'd probably support that with ongoing PRP and ozone therapy, as well as red light and acupuncture and, sound wave and things like that, oxygen therapy, over the next year, really. Because remember that signaling cascade I talked about with the stem cells? That lasts for about 9 months to a year, where those cells are actively kind of working and healing. And so if we get the knee feeling better, you start walking better, then all of a sudden the radiculopathy and the nerve pain goes away because you're not walking funny anymore. So yeah. And again, tingling and nerve pain can be caused by many different reasons. And so, it could be coming from your SI joint, from your sciatic nerve, could be coming from your low back, could be coming from a nerve impingement here at the hip, it could be coming from the knee. Hard to tell for sure. Yeah. And so we'd have to try a few things and see what works, kind of thing. A lot of times imaging is very helpful, especially if we haven't had any and somebody comes and says, I got back pain. Well, what's going on with your back? I don't know. Go get an x-ray and bring it to me so I can look at it, or an MRI or a CT scan. It's always helpful to have the imaging because I can actually see what's going on and pinpoint the areas of damage. If I'm going in blind, I'm just like, yeah, I can put an injection in your knee. It's going to go in the knee, but it's not going to target anything specific. Yeah, always good to have updated imaging. Yeah, always a good thing to have more information to go on. So, sorry, there was a question back here. Yeah.
Wow.
And that's pretty typical. Okay, again, knees, number one thing that I treat with stem cells, and usually 90% success rate. Yeah, yeah.
Yep.
Yeah, again, tingling and neuropathies and radiculopathies like that, nerve problems can be caused by many different reasons. So that's why it's good to have imaging, because if we get an MRI of the back and you say, oh yeah, look, you got a big, huge disc bulge at L4-5, that could be a reason why we're getting some of that nerve tingling going down, and so, but if you get an MRI and the back looks good and you're like, okay, it's not the back, probably, maybe it's the hip, maybe it's the knee. So we'd try some things. Okay. Yeah. It does. Very well. Backs are the number 2 thing that I treat. So knees, then backs. Backs are a little bit more difficult just because there's so many mechanics involved in the back. And the back, especially the low back, takes all the pressure of the body is sitting on that low back. And so I don't quite get as much of a success rate with the back as I do with the knees. My success rate with backs is probably about 80%. Okay, there's about 20% that just don't get as much of a benefit as they hoped. Usually everybody does well though, because what do the stem cells do? The stem cells are very good at anti-inflammatory. They're a natural anti-inflammatory. So they decrease pain and inflammation in the area and they stop that inflammation cycle, right? And so if you can stop that inflammation cycle, you can start the healing cycle and things feel better. Also, if you decrease inflammation, you decrease swelling. And so we get less swelling on the nerves, less swelling at the muscles. We don't get as much of that tingling and radiculopathy pain. So backs actually respond very well.
Awesome.
Sometimes as soon as a week. Sometimes as long as 6 months. It varies. But on average, people usually see some kind of change or a result within the first month. But like Jordan said, I've got a lady I'm treating for neuropathy. 1 week out, she's like, yeah, I think it's feeling better. Yeah.
That's great.
So
We have time for just a couple more questions. Go ahead.
Jordan might be able to answer that one better.
So, great question. I can only speak for the Cottonwood Clinic, but our consult is $97 with Steve. I'm assuming it's very similar at the other locations as well. Yeah.
And the stem cell program will be tailored to you based on what you have going on, and then that will kind of dictate what the cost is of the entire program. But everything else that I mentioned, all of those extra modalities are usually included in the program because we want to support the cells and get the best result if possible.
Question. Any other questions?
Neck responds just like the back. Neck is a little bit more funny because everything is jammed all into that one space, right? Correct. I misspoke. The neck is a pain in the neck.
There it is. Bring in the
literally.
nachos.
And so, but because everything is jammed all into that one space right here, and you have 7 vertebrae all in that area, things can get kind of wonky real quick, as we saw in that picture. And then you have muscles that are pulling on all of these vertebra, right? And you can get ligament damage and you can get spondylosis where they're... So the stem cells will decrease the inflammation, increase the healing of the damaged tissue around the area. They can actually help increase your disc space a little bit. So if you have degenerative disc disease and the discs are starting to shrink, the stem cells have been shown actually to increase the disc space a little bit. Now, if you have compression of the vertebra, it doesn't help a whole lot with that, but it can increase bone density of the area, relax the muscles, heal the damaged tissue, and decrease the inflammation so that it feels a lot better. Yep. Yep.
Let's go right over here and then right back here.
Well, could
So autoimmune disease, MS, no cure. Typically, I would treat MS with IV stem cells. And what we've seen with that over the years is that we get lessening of symptoms, we get increased functionality and increased mobility of joints and muscles and tendons kind of thing. And so things will just work better and we have less symptoms. It's not a cure. Nothing can cure MS. But what we see is a significant decrease in symptoms that's long lasting, at least for years. Correct.
really?
Yeah, and even that, you won't get that here in the States unless somebody's expanding them, which they're not allowed to do. You're not allowed to mess with the stem cells here in the States. When I mentioned the 300 billion, I was talking about the guy down in Panama who's expanding the cells, and that's what kind of he totes is like 300 billion, stem cells.
All right.
Right. Here in the States, with proper FDA-approved labs that are harvesting the stem cells, you can expect somewhere between 10 and 20 million stem cells per cc. Per cc. It just depends on the lab.
A lot.
I wouldn't say better results. You might be getting more cells or claim to be getting more cells, but there is also studies that say that expanding the cells shortens the lifespan of the stem cells, and therefore you get a worse result in the long term because you've now expanded these cells that they have nowhere to go once they put them in you. And so there is some research on that as well, that more is not necessarily good.
No.
No. Did you come in a little bit late? Yeah, okay. So you may have missed the slide where I said I do not recommend autologous stem cells. I don't recommend taking them from you and putting them back in you because you don't make as many stem cells as you used to. They're not as healthy as they used to be, and you don't know the quality or the quantity. And so my recommendation always is to use the umbilical cord and placenta tissue stem cells. Always.
Yeah, that's part of. We have that on a sheet too, in the back. But I'd love for you to
Right.
answer that. Yeah.
So the donors are from healthy C-section deliveries. Regenerative Research Group got most of theirs from the hospitals here in Utah, from healthy C-section deliveries, scheduled C-section deliveries. And all of these mothers were screened to make sure that there's no diseases, no cancers, nothing like that, that everything's clear. And then once they get the tissue, it's also screened again to make sure that the tissue is viable and that there's no contamination or anything like that.
And my understanding is that these can't be purchased. You can't
No.
sell that. They have to be donated
Correct.
tissue. All right. I got a question right here in the back. Yeah.
So there hasn't been as much studies for mental health, like schizophrenia, and dementia kind of falls along with Alzheimer's a little bit. And there has been some pretty good studies with Alzheimer's, as well as clinical experience and anecdotal data that shows that when done properly, like with the intranasal technique, when we can actually get the cells to the brain past the blood-brain barrier, then yes, there is a very good response. And the cells go to work immediately, and there can actually be some halting of worsening of symptoms with Alzheimer's and dementia, along with some other modalities and supplements and things like that. But there are some very good studies. There's a lot of animal studies and some human studies, but the response is good. The best case scenario is we actually can reverse it a little bit and get a little bit of the memory back, and at least halt the progression of Alzheimer's and dementia. But again, not a cure, not a treatment specifically. So again, autoimmune diseases. IV would be the typical treatment for that, along with modalities and dietary nutrition changes, possibly looking at hormones as well, because the thyroid is not working for some reason or other, and there's multiple reasons why it may not be working, but you still need the thyroid hormone in order to work. So a lot of people will be on levothyroxine, or they'll be on some kind of combo like Armour thyroid or something like that. And if those are out of whack, then you have to adjust those as well. But stem cells have been shown to be helpful for the thyroid, and some people can even get off their thyroid meds sometimes.
Mm-hmm. Well, I think we have time for 2 more questions. Let's take one over here, and then was there another one? I think that's it. Great.
The jury is still out on cancer. A lot of the research hospitals and labs are doing a lot of research on using stem cells to cure cancer. I have not treated a whole lot of cancer patients. I've treated some over the years, but it's very difficult to ascertain a result or a benefit depending on the cancer that's there. And so some studies will show that, yes, these MSCs have a good response when injected into a prostate that's cancerous, but not all the time. And so it's very unknown right now. Typically, if it's an active cancer that's actively going on, usually that means they're under some kind of treatment, either chemo or radiation or doing something. And I definitely don't recommend doing cells if they're doing that kind of treatment, because it'll just kill them. So that's the hard part. Since back in the 70s and 80s.
Thank you.
Mm-hmm. Yeah, and there may be some labs that are accepting those. The lab that we use, RRG, only takes scheduled C. We only took scheduled C-sections. Yeah. Yeah. It may have been for research. Yeah, it may have been for research. Yeah. Right. So a vaginal birth causes a lot of trauma to the tissue, a lot of trauma to the umbilical cord, to the placenta. There could be tearing. There could also be contamination because there's a lot of bacteria around that area. And so the only time where we know it's going to be a total, decontaminated state or sterile state is when with a C-section. So, good question. Okay.
Awesome.
Good
Well, friends, thank you so much. Can you give Jordan and Stephen a huge round of applause? Well, we hope to do more of these. We hope to continue to spread the knowledge and spread the information and maybe prevent some surgeries, maybe help some surgeries that have already happened. We do have some information more in the back. For those of you that have more questions you want to jam with us, we'll be hanging out a little bit more in the back.